Well, it happened. Never did I ever think it would. Infection control is a household word. Today, thanks to COVID, everyone knows what hand hygiene and PPE mean. They know that CDC stands for Centers for Disease Control. Today, our patients know a lot more about infection control than they ever did. Before COVID, patients didn't question our infection control. They simply relied on us to keep them safe. But COVID has changed so much of what we do for infection control, what we wear for PPE, even what our practices look like. Now patients expect us to be both tooth whisperers and masters of infection control. So to keep their trust and exceed their expectations, we have to shine a light on exceptional infection control. Today, I'm going to give you 4 tips to help you and your team demonstrate that when it comes to infection control, you are brilliant. My name is Leslie Canham. As a CSP, Certified Speaking Professional, I've conducted over 2,000 presentations over the last 21 years on OSHA and infection control. Following my programs, audience members report that they can immediately implement an action plan. They have more confidence in protecting themselves, and they can provide every single patient with a safe dental visit every single time. So are you ready? Here we go. Tip number 1. The first step in infection control is hand hygiene. Experts tell us that we should wash our hands for at least 20 seconds. I wanted to know how long dental professionals spend washing hands. So in my hand hygiene workshops, I set up wash basins and a stopwatch to find out. Good news, we spend about 40 seconds on average washing our hands. Patients now armed with infection control knowledge are watching us, and they want to see that we wash our hands. If your sink is not in direct line of sight, patients might think you forgot to wash. So be sure to wash your hands and maybe step in front of the patient to dry with the paper towel. If you use an alcohol hand sanitizer, you might make a show of rubbing that sanitizer into your skin. If patients think we skipped washing our hands, we won't have their trust. The first step in infection control is hand hygiene. Tip number 2, don the right PPE and wear it correctly. For over 30 years, our PPE consisted of clinical jackets, surgical face masks, protective eyewear, and gloves. Pre-COVID, most of us didn't even know that there were 3 levels of mask protection, and we never, ever considered wearing an N95 respirator. But SARS-CoV-2, the virus that causes COVID, is an aerosol transmissible disease, and it changes PPE for dentistry. In place of safety glasses, we wear a face shield. And when we're performing aerosol generating procedures, an N95 respirator is our best defense. We look unrecognizable in our new PPE. In fact, some of us took a photo of our face and pinned it to our clinical jacket so patients would know it was really us. Well, now that we have the proper PPE, let's wear it correctly. Public service announcements and posters are everywhere on how to wear a mask. If you wear a mask below your nose or on your chin, it's a clearly visible misstep that undermines credibility and safety measures. Can I just take a minute to address the elephant in the room? There's a deep divide over the requirements to wear a mask. Wearing masks has caused tensions about public health, civil liberties, and personal freedom. Some people refuse to wear a mask out of principle, and others are upset by the way people ignore the mask requirements. Some patients think being vaccinated means they don't need to wear a mask at all. And to make matters more confusing, CDC changes mask recommendations frequently. So how do we keep the peace and follow best practices during COVID pandemic? Let's start by advising our patients of the mask policy in our healthcare setting before their visit. It can be part of the confirmation call. We can also put a poster on the door to our practice to let them know that there's a mask requirement. By the way, I suggest that you put the current date on the poster so it doesn't look like yesterday's news. We can remind patients that source control and physical distancing are CDC guidelines for everyone in healthcare settings. What if a patient still rejects the mask policy? Well, the best thing we can do is show empathy. We might say something like, I understand how you feel, and I wish we had a choice. But as a healthcare provider, we're required to follow all CDC guidelines and OSHA regulations. You know what? It's pretty hard for a patient to argue with that. Tip number 3, demonstrate proper use of disinfectants and disinfect high-touch surfaces. Our patients learned a lot about disinfectants during this pandemic. In the early days of COVID, people were advised to disinfect everything from household surfaces to shopping carts, even their groceries, for heaven's sakes. Businesses were all required by OSHA to train employees on COVID prevention policies, including how to clean and disinfect surfaces. Disinfectant wipes flew off the shelves during that first year because everybody was disinfecting everything. Our patients know a lot more about disinfectants than they ever did before COVID. So let's demonstrate proper use of disinfectants and extend surface disinfection beyond the clinical area to the reception room, to countertops, doorknobs, even pins. Tip number 4, be well acquainted with the infection du jour. Now, what I mean by the infection du jour is know what the current infectious disease or outbreak of the day is. I follow the news for breaking stories. Patients do too. Today, and for the last 2 years, it's COVID. Previously, it was Zika virus, MRSA, remember Ebola, and of course, measles and chickenpox. Keep your ears open for dental infection control breaches, like when contaminated dental unit water sent 90 children to hospitals with serious infections, or when announcements are made about breaches in infection control requiring dental patients to get tested for hepatitis or HIV. Patients may be very concerned about their safety in your chair, and rightfully so. They may have questions about infection control. And if we are responsible for their safety, we better be able to respond appropriately. That means each and every dental team member is knowledgeable about the infection control of the disease of the day and the infection protocols that we take to keep our patients safe. You know, when it comes to the infectious disease outbreak of the day, if we don't have knowledge and answer incorrectly, our patients can check our answers in a matter of about 30 seconds on their smartphones. So we better fortify ourselves with training and information and make dead certain that our infection control programs are current and on track. This includes attending infection control courses and conducting in-office training. If you need more ideas and inspiration on how to make infection control sticky, attend my infection control programs. So there you have it, 4 tips to show your patients when it comes to infection control, you are brilliant. Perform hand hygiene, and so your patients know it's been done. Wear the proper PPE and wear it correctly. Demonstrate proper use of disinfectants and disinfect beyond the clinical areas, and be knowledgeable on the infectious disease of the day. We're not post-pandemic yet. Even if COVID disappears completely, we won't back down on proper infection control. The lessons learned from this pandemic, we in dentistry did a great job of upping our game on infection control to be safer. Patients, with their new knowledge of infection control, are aware of the extra steps that we take. And infection control training is an ongoing journey. My programs directly address the frustrations that dental teams face today, like not having enough time or manpower, or simply not knowing where to start. My desire is to help dental professionals learn how to simplify infection control and safety so they don't have to struggle. My name is Leslie Canham, and it would be a privilege to be invited to bring this message of clarity and confidence to your attendees.